Welcome everyone to the latest edition of the StateScoop webinar series sponsored today by Microsoft. I'm your host, Jake Williams, StateScoop's Manager of Strategic Initiatives. Today we take a look at transforming government with digital service innovation. We'll explore how state and local agencies are transforming themselves digitally to change the way they do business and how they're building a better, more responsive government in the process. Joining us today are a few state IT thought leaders who've tackled some of these issues and have agreed to share some of the key lessons they've learned along the way. I'm pleased to welcome Michelle Burk. She's the CIO and Deputy Director for Ohio's Department of Developmental Disabilities. Michelle directs information technology implementation used by 3,000 staff and 15,000 providers that deliver $2 billion in benefits for 100,000 Ohio residents. Joining Michelle today from Ohio is Matt Curran. He's the Application Delivery Manager in Michelle's department, where he provides senior leadership to application development initiatives. Welcome, Michelle and Matt. Thanks for joining us today.
Thank you. Glad to be here.
Also joining us today is Brandon Williams, Colorado's relatively newly appointed Digital Transformation Officer. As DTO, Brandon is working to streamline public-facing government services with a keen eye to user experience and successful interactions with government that don't involve paper, long lines, or frustration for the citizen. Brandon, thanks for being here.
Yeah, great to be here. Thanks.
And finally, we have Herb Quindy, the Public Sector Director for the U.S. Dynamics Industry Sales Division at Microsoft. Herb is a subject matter expert and strategist in optimizing government business operations to deliver continually improved citizen services. Herb, thanks for being here.
And I'm glad to be here. Thank you.
I also want to welcome our audience, including those joining us live today, as well as those tuning into the archived on-demand edition of this program. I'd also like to thank Microsoft for sponsoring our program today. Before we begin, I'd like to help our audience get a little bit more familiar with our console and how they can participate. So at the bottom of your audience console are multiple application widgets that you can use throughout the program. If you have any questions for our presenters during the webcast, you can click on the Q&A widget at the bottom and submit your question. We'll try to answer as many of these as we can during the live webcast, either during the presentations or toward the end of the program, and I'll moderate that discussion. A copy of today's slide deck will be available in the resource list widget that looks like a green folder at the bottom of your screen. You can expand your slide area by clicking on the maximize icon at the top right side area or by dragging the bottom right corner of the slide area. If you have any technical difficulties, please click on the help widget. It has a question mark icon and covers common technical issues. And finally, an on-demand version of this webcast will be available approximately 1 day after the webcast for up to 90 days. It can be accessed using the same audience link that was sent to you earlier. So if you have colleagues or friends who might benefit from today's presentations, share your link with them, and they can view what you're seeing now. And with that, let's get started. Michelle and Matt, let's turn to you first. You've been working to transform the way that the Ohio Department of Developmental Disabilities delivers digital services. Can you tell us a little bit about what you've learned about transforming government with digital service innovation?
So, absolutely. Let me give you a little bit of background. Of course, the Ohio Department of Developmental Disabilities oversees a statewide system of service and support for nearly 100,000 people and their families. We administer 3 Medicaid waivers supporting 40,000 people who receive services from over 15,000 waiver service providers. Annual claims for the administered waivers are in excess of $1.5 billion. Given that the DD system is county-based, each of our 88 counties have over the years developed largely unique business processes and service delivery systems to meet the needs of their local community. Over time, the result was complicated, often manual, and with many redundant processes. This was intensified by declining financial resources, a significant growth in the number of people in need of services, high cost of existing services, making business as usual unrealistic and cost prohibitive. At the same time, the Centers for Medicare and Medicaid Services, CMS, instituted federal regulations that motivated states to make plans and services person-centered. That is based on the needs and ambitions of the person at the center of services. County boards of developmental disabilities began to feel the need for changing business processes to support their person-centered work and to create efficiencies in administration and in service delivery. With the adoption of person-centered practices and the need for increased efficiency, DoD stakeholders came together to examine processes and look for opportunities to improve service delivery in a way that would support a person-centered approach. The system faced many obstacles. Of course, there are varying processes, procedures, and providers across counties. The caseload of county board staff varies widely, as do their resources. In each county, service support administrators, SSAs, function like case managers, coordinating services and service providers. Coordination was often hampered by large caseloads and a lack of resources. Service planning processes often lacked collaboration from agencies outside of the developmental disabilities field. Often, service planning could be inconsistent between SSAs within the same county. Little collaboration existed across the team. When collaboration occurred, it was typically done via phone or random emails. Within person-centered work, the team is defined by the person accessing services at the center of planning, their SSA, providers that implement the services the person needs, and family members or other trusted supports. The team provides input on services needed and how services will be implemented. Getting the team together for yearly meetings is challenging enough while balancing schedules and resources, but teams sometimes have to meet more frequently if the person has complex needs or the services and the service plans change. Once the team met to develop the plan for services, it was often difficult to reconvene the team if changes were needed. There was no single location or document repository where the team could review the plan in real time. Everything was done by email and by email attachments. In addition to being a document that addresses the needs and ambitions of the person accessing services, the plan is a contract for Medicaid services and requires signatures before implementation. New signatures were needed if the plan changed. Provider engagement was limited to team meetings, monitoring of service delivery, and follow-up audits. From a provider perspective, separate processes to document service delivery were cumbersome and viewed as unproductive. There was no real-time information communication for the individual's family and/or guardian. The opportunity to directly influence or provide feedback about a plan for services was limited. For the person accessing services, who is at the center of planning, for their providers and other team members, and took place primarily during scheduled meetings. Plan changes were made on paper and driven again by email or phone calls. A solution was needed that allowed the team to interact with plan information in real time and get the signatures that would allow for plan implementation faster. No electronic document repository was available. Given much of the process was paper-based or entered into local systems, there was need for a central electronic document repository for securely storing documents related to the service plan. SSAs had to track contact information for all team members for each plan on their caseload. Given that one's team may include physicians, nurses, home health aides, direct service providers, provider agencies, family members, and personal contacts of the person, like neighbors, friends, or other social connections that may provide some kind of support, this task could quickly become expansive and time-consuming. SSAs are required to access supports outside of available developmental disability services whenever possible. SSAs were tracking information on their own, about the availability of services around them, then tracking the services accessed in case notes. While DODD has supplied electronic processes to report individual information, there was a gap in providing an electronic solution that utilized person-centered planning for ISP development and integrated DODD legacy data stores. Each county relied on DODD legacy applications to perform a variety of functions. This approach forced counties to log in and out of a variety of applications. SSAs did not have a single repository that pooled all of the person's information into a common platform. Matt?
Thank you, Michelle. So we've heard a little bit about the situation and obstacles. Now we want to cover some of the actions that we took to address those obstacles. The counties that participated in the early development of a person-centered approach piloted manual person-centered processes. One of the objectives that DODD ITS acted on was to create an electronic process that facilitated the person-centered process. ImagineIS was developed to make it easy to do discovery and develop outcomes with supporting Medicaid and local services by capturing information in 8 key life areas. The electronic platform was developed to engage team members so that collaboration and sharing of information across the team was transparent and easy. This effort involved taking the manual processes and designing a set of workflows to establish the foundation of a person-centered DD system. For providers, the system implementation means that efforts have become less focused on a prescriptive or a prescription of service and more focused on what is important to and for the individual. An outcome-based approach with emphasis on action steps and feedback through a learning log will become or has become the new norm. The new system helps individuals with developmental disabilities and their families and guardians create and coordinate service plans for skills development and achievement of individual life goals utilizing these person-centered principles. Traditionally, development of the individual service plan, or ISP, has had many challenges, including the variations of ISPs across the county of what would be included in the plan, including communication of ISP planning meetings to all participants, getting agreement on the service delivery, and ImagineIS was developed to utilize these artifacts captured in the discovery and outcome service processes to provide complete information about each individual's ISP, including agreement, approval, goals, services, provider, funding sources, and progress. ISPs were developed to include individual county branding on the document in order to maintain county autonomy. Collaboration and transparency were achieved through the ImagineIS electronic solution. Feedback from team members that include individuals, families, guardians, and providers was done by setting up a dedicated portal. This allowed these team members to have a place to review all of the relevant data and ensure that the developed ISP included the needed key components. The ability to capture, store, and access key documents in a secured manner also supports the ISP process. ImagineIS not only makes it easy for participating counties to initiate a person-centered case that captures case data, but also allows them to capture information about the service recipients and what's truly important to them. It focuses on who they are, both their likes and needs. Additionally, development of workflows is important, but enabling those workflows with electronic processes aids in efficiency gains. As part of the ImagineIS development, using Microsoft Dynamics CRM, DODD ITS was able to quickly develop dashboards to surface alerts and notifications for the county workers, including case managers and case manager supervisors. These alerts and notifications help the workers better manage the needed work activities. The ImagineIS system was developed to use a color coding scheme to raise awareness of critical items. Additionally, these notifications served a collaborative purpose as case managers received notice when they had a new person assigned to their caseload. On the portal side, the individual and other related team members also used a similar dashboard to stay informed of statuses of discovery, outcomes, and the ISP where their input or agreement might be needed. DODD ITS also leveraged the Progress Tracker status bar to give caseworkers a visual aid in understanding the progress of the discovery, outcome, agreement, and ISP processes. The Imagine IS application provides a one-stop location for the caseworker to get a snapshot of characteristics about the individual, including basic demographic information, functioning level, contacts, addresses, and preferred method of communication. This front page, working in conjunction with the portal, allows the individual to describe what people like about them, what their favorite interests are, and who their friends are. Individuals can upload pictures. Their case manager can approve those pictures, and once approved, those are surfaced on the front page. Imagine IS integrates key data from other systems to streamline the caseworker's workloads and provides a more complete view of the individual. The front page also holds data around essential health, such as medication, adaptive devices, DNR orders, and diet. Icons are illuminated on the front page when there's additional content present in these areas. Imagine IS also has connections to internal and external data systems. An illuminated icon approach is used on the front page as an indicator for persons enrolled on a Medicaid waiver or on Medicaid itself. Data to support this is captured from the Department of Medicaid. Connections to other DoD systems such as incident tracking and waiver management are also inherent in the application. With full visibility of the business challenges and clear direction on the desired end result, DoD evaluated many options when developing the Imagine IS solution. After evaluation of a number of rapid application development tools and approaches, DoD settled on the Microsoft Dynamics platform due to the configurability, ease of customization, and time to market. The out-of-the-box functionality addressed usability and privacy concerns, and the ability to interact with legacy data stores certainly supported the decision. As we look at the results, people working together on a complex problem to deliver a solution that meets the needs of a vulnerable population and supporting their advocate was really key. Many say it takes a village to raise a child. In this case, a group of individuals from various business domains coming together to create an impressive system that met the goals and objectives outlined from the original stakeholder vision was truly empowering and a good success story. Over the course of the development effort, many individuals contributed to the success of Imagine IS, but could not have moved forward without the support of the Governor's Office and the Ohio Department of Developmental Disabilities Director, John Martin. Director Martin's vision was that the Imagine IS process would serve as the underlying foundation for the initial development and continued adoption for person-centeredness. And some of the key attributes of that are that the person is recognized and valued for their contributions to the communities, and it supports a web of relationships, both natural and paid, within the desired community and neighborhood. Imagine IS also enables people to lead happier and more productive lives. A staff person recently commented that unlike most technology engagements, this is one that helps folks directly. It's a story about changing people's lives. The complex case management solution was developed to help individuals with developmental disabilities and their families create and coordinate service plans for skills development and achievement of individual life goals. Imagine IS's objective was to eliminate cumbersome and disjointed county-by-county service delivery, replacing with streamlined person-centered case management that helps people achieve their best possible life. Counties were able to also streamline administrative processes and engage the person and their circle of support in a collaborative manner and transparent manner. From a programmatic perspective, it's important to understand the benefits directly attributable to the individuals using the system. Of the more notable benefits in the area, we find that work process improvements for the SSA directors and the SSAs, otherwise known as case managers, to manage their work through dashboards and alerts and notifications is very compelling. Giving the SSA directors the ability to have oversight and approval over work staff is significant. We saw process improvements for county finance managers to manage local dollars, while we implemented a standard local service taxonomy to manage the local service delivery aspects of this. Individuals and families now have awareness and approval of service delivery, and this transparency gives them the ability to inform SSAs about what's important to and important for them, which facilitates effective communications. The new system helps individuals with developmental disabilities and their families and guardians create and coordinate service plans for skills development, and it also helps providers to be more integrated into the process as they can now develop action plans and steps for service delivery along with sharing feedback about outcome results. The electronic collaboration across the team provides more focused service delivery and allows case managers and providers to focus on the individuals served rather than documenting service delivery through outdated paper forms. The truly integrated solution gives a full picture of the individual to the team. As we look at next steps in the results, DoD is in the process of moving toward a cloud migration of what is currently an on-premise Microsoft Dynamics CRM deployment. So that will be our key next focus moving forward.
Wow, that's outstanding. Matt and Michelle, thank you guys so much for that story, and I loved the analogy there about it taking a village and how that applies to the work that you guys are doing. That's awesome. Thank you so much. It sounds like you got some exciting stuff on the horizon. Now, Brandon, let's turn to you. You might be seeing some similar or some different stuff in Colorado, especially in your new role as DTO. Can you tell us a little bit about your experience and what you've learned along the way?
Yeah, sure. And, Matt and Michelle, that was a great story. I think that's a common challenge that we all face, which is taking these bureaucratic, necessary processes and putting a human face on it. I love the fact that you included the color codes, the image uploads, and really made it kind of a social aspect as well. So, here in Colorado, we're wrestling with a lot of the same things. I think this is one of my favorite images to describe kind of how government has traditionally approached these problems. Clearly this is a public park, and the user experience cuts across the grass. But the design and planners for the park actually thought about the bricks, the layout, and didn't really take into account the actual trajectory. I think we do the same thing in IT every single day. And, having worked on the program side and now on the IT side, what I see is that we've always been focused on building cars, and we focused on the horsepower. We've thought about how big the engine needs to be, how powerful it needs to be, and really the technical components. We didn't take into account as much the reason that you buy a car, the color, the look, the feel, how it corners. And so that's where we're really kind of branching out into now with digital transformation here at the state. So we're not unique in this. I mean, I think my title is Digital Transformation, which I think in common language is pronounced buzzword officer. But we're not unique. There's other thought leaders, innovation. I mean, everybody's kind of wrestling with this same basic problem. And the problem seems to be, at least here, that we see there is the ground has shifted. Our users have become more tech savvy. The things that they expect in their personal lives when they interact with private sector, mobile applications, things that they're accomplishing with their family and friends, they want to see that being brought into government in how they interact both internally as well as externally. And I think it's really raised an opportunity, but also some challenges from an IT perspective, because traditionally we've been very rooted in those hardware requirements, delivering the, almost like a public utilities. We give you the internet, we give you the box, and we haven't really been charged with looking into business processes or leapfrogging into what's coming over the horizon. And I think that's where we find ourselves now. We constantly get more involved in the actual process of business and maybe even some of the policy aspects of how technology can support that. We found a really helpful niche where, innovation and kind of these, IT leaders at agencies that may not work in IT, but who are intimate with the business process are really that sweet spot of being able for us to step in at the program level and be able to help change a lot of that. So from a digital transformation specific goals that we've got right now, we're focused in two main areas. One is certainly accelerating innovation, and we're using that. We're building upon the great work that Go Code Colorado has done. We're working very closely with high school and universities to do things like rapid innovation events, hackathons, design sprints, the kind of traditional approach of taking data and trying to do something with it, but asking people with fresh eyes and fresh approaches to kind of help us analyze those challenges. We've taken a unique turn, though, and the types of challenges that we're taking aren't just data-based. We're looking at challenges of how we would manage a technical workforce and going out to the universities and asking them that question. What do they expect when they enter the workforce? And then kind of building systems and seeking solutions around that. We've also built a pretty healthy statewide and agency innovation teams, and this was really based upon previous scars where we had taken good technology ideas, gone in at an agency director or IT director level and said, this is going to be amazing, rainbows and unicorns. When this tool gets here, everything's going to be great. And, by and large, they looked at us and said, well, really, can we just see the ROI? Can we see what it does? I mean, I take your word for it, but we still need to see it on the ground. And so the way that we found out the best way to do that, at least in the state, was going in, finding those individuals who were tech savvy, but who were program side, maybe not OIT, giving them pilot access, giving them greater access to tools that we were thinking about, and really organizing them, starting a grassroots effort so that as we were finding solutions, they were embedded with our teams, and those solutions boiled up within the agencies, not necessarily just driven from a top-down decision that we're moving in that direction. One of the things that has continued to come up, though, is that focus on user experience and where maybe the biggest challenge is laid out for IT right now. If you think about like state of Colorado, and I'm sure other states are in the same in the same bucket, which is we're effectively 20 to 22 different companies who are loosely affiliated under a state seal. And in our case, what that meant was we had individual personalities on all of our different websites. You had different focus areas of programs they were trying to push, but we had never really taken a look at the user flow and analytics across the agencies. And when you're talking about something, even like we talked about before with medical benefits, you're looking at things that spill over into unemployment insurance, maybe into registration, vital records, et cetera. And there are lots of different entry points, and being able to make sure that the user experience, no matter what entry point you're getting to, that you can cross from one agency or one program to another is kind of a key focus for us right now. And the way in which we're approaching that is really creating a smart directory within our website that will have relevant links looking across the domain for suggested other programs that you might be interested in based upon the search that you're looking for, and also kind of getting local about what you're looking for. So for example, if you're looking for driver's license information, being able to read off the mobile device and be able to return maps of your closest DMV, suggest the records that you're going to need, and then provide a link to schedule an appointment. So kind of providing that very customized user-focused experience on the website. And then also addressing how we can formalize user experience for our developers and for our program staff. So it's really coming up with common vocabulary or vernacular around user experience, establishing some standards, policies, and practices. And so we're doing this, of course, I assume like others, on a fairly limited, this is our budget. It's trying to do more with a lot less. And I think from a transformation and innovation point of view, I'm probably not alone in saying that a lot of the things that we're trying to break are things that we don't own. And so it's not only limited budget, but it's also limited ownership. And so a lot of our effort is going into relationship building. You have 9 meetings where it's smile and scar sharing, so that one meeting you can all look down and say, you know what, that website does need to be enhanced, and here's how we can do it. And so that is certainly a huge effort. but we've had some early wins, and here's one of them. Maybe a little small on the screen, but I can walk through it real quick. So our Department of Regulatory Agencies, they manage e-licensing. You know, we've got, 220 different things that we license in the state. And a lot of those are licenses that need to be checked while users are in the field. I mean, take public health, nurse practitioners, for example. You want to validate somebody that's coming into your office, or maybe they have to prove to you that they actually have the license in place. We had, in a traditional way, we had created a very good engine. We had all the right horsepower for the database, but when it came to deploying it on our website, we really hadn't thought about the mobile interface on that. And so the experience was kind of blocky. It was a little awkward. And this was one of the cases where we came in with a user experience expert. We sat down with the team. We had the UX person actually lead the discussion, and we took a look and came up with wireframes, because originally the ask was, how do we create a mobile app? And we said, well, hang on just a second. You've got a great database. Your guts are good. What we need to do is put a nice wrapper on it. And so we sat down and we were able to draw up wireframes of what the experience should be like across mobile platforms, across different operating systems. And we really used that as the guide that we were driving to, and it had a lot of success. And so now this is being rolled out. I think it's already live for the public health practitioners, and then it's going to the other e-licensing aspects. So it's little things. I think if you ask me about digital transformation right now, it seems to be 80% incremental change within operations, and then 20% kind of the big moonshot, big project stuff. I think one of the other things that we're really focused on, of course, in this is all of those different touch points, not just from an analytic perspective and making non-mobile friendly sites mobile friendly. We're seeing, just incidentally, 35 to 40% of the traffic coming to our websites now being mobile based. So we've got a lot of effort into making those smart directories and the mobile experience good on our websites. But it's also kind of leapfrogging and looking over the horizon of how in the future users will gain those services, so that as we're doing things like smart directory and analyzing information and organizing it, we're thinking about how we can organize it best to take advantage of emerging technologies like chatbots, natural language search, voice assistants, and then also a back-end focus on going towards electronic signatures. For decades, we haven't been able to take advantage of electronic signatures, although those are widely used in the private sector. We're now at a point where we can actually go to RFP and start soliciting for services for e-signatures, and I think that'll be one of the biggest revolutions for us in Colorado, maybe since the creation of that first website, because it'll affect both of our internal and external workflows. So that's kind of how we've approached it. I'm super curious to hear how others have done so. I think one of the big messages that we've been taking around the state is that every state employee, every contractor support, we're all in this revolution together, and it's the responsibility of each of us to figure out what needs to be broken and then come together to kind of figure out how to fix it. So with that, Jake, I'll hand it back.
Thank you so much, Brandon, for sharing your experiences and your fun graphics here. That's awesome. That was a really exciting presentation, and it's always great to see the amazing work underway in Colorado OIT, and exciting to see how states are beginning to think the way that you are and starting to follow the lead that you guys are taking there. So hopefully some will walk away with some more valuable inspiration today as well. I want to turn now to Herb. Herb, you've seen it a lot in this space. Do you want to tell us a little bit more about how states can mobilize and transform the way that they're delivering services with digital service innovation?
Absolutely, Jake. Thanks so much. First, what I want to do is I want to recognize the folks from Ohio for just a really inspirational presentation about their problem solving and the end result, which is to transform the lives of the people they serve. And Brandon's presentation as a Chief Innovation Officer is basically the idea and creating the kind of disruption necessary for clearer thinking to take advantage of what technology can do today. And these are just models of what the future holds for us. When you really look at what government is, it's very dedicated people looking every day to figure out how they can serve their constituents better. And I have the pleasure of being in a position where I travel around the country working with federal agencies, state and local governments to be able to figure out how to optimize the way that they do business and how to integrate technology to be able to do that. So we've heard now this buzzword of digital transformation. It's all over the place. It's something that's been around building over the last 2.5, maybe 3 years as an attempt to capture the concept of how do you take information and do something new with it. And so what you heard from the Ohio team is the way that they use Dynamics 365, which is a Microsoft product that is a platform for being able to do purpose-built applications and be able to aggregate data, in a fashion that allows for the next best decision, married to things like Office 365, which of course of the vast majority of folks listening who work in government, those are the basic tools, Word, PowerPoint, Excel, and so forth, and increasingly large numbers of people moving to the Azure cloud. But that's not all of it, because digital transformation also includes now integral things like machine learning, the ability for computers to see patterns, take those patterns and turn them into something that helps people make better decisions, or Cortana artificial intelligence, which is able to understand who is communicating with you in government and be able to provide background information and recommendations of what would be the next best decision, chatbots and so on and so forth. So what we're really looking at here is that software is becoming society broadly. So if you have a smartphone, you're a walking piece of software now. If you own a digital watch, you're a piece of walking software. And it's in your home already in many different kinds of places, and soon you'll be wearing it. And essentially, every surface soon in the future will be run by software. So Microsoft's approach to this is we've got to take advantage of this, and our bold ambition is to ensure that every person and every organization on the planet can achieve more every day. That's what we're out to do, and in the area of government, it's being able to empower that kind of democracy. So I've decided that the concept of doing more with less, more and more, it just leaves a bad taste in my mouth when I hear it, because often the way that that's presented is a rationalization for why things sort of don't get done and why the resources aren't there to be able to do the kinds of changes and transformations that everyone knows are necessary. So to me, it's really about maximizing what you have in talent and dedicated civil servants who are there every day showing up with goodwill, trying to do the best for their constituents, and leveraging the huge store of information, of data that's buried in ancient legacy technology assets and systems, then keeping that information locked in there that's unavailable to the people who need it most every day, your constituents and your employers. So that's, to me, what we're really talking about when we're addressing these kinds of issues. So it's about data, it's about analytics, and it's about the cloud. That's really what we're talking about, the ability to liberate the information that's locked up in these systems and take that data and free it from every piece of infrastructure, and this will sound a little bit counterintuitive, from every application, from every integration, where the data now becomes a valuable asset. And what you do is you can reconfigure that data and present it in a manner that allows for better decisions, for better analysis to understand this. The cloud is simply a place where you're able to take that data, and it has multiple services. In the 20th century, we used to call this middleware, for example. And if you think about service-oriented architectures, and you think about enterprise service buses, and a lot of terminology that probably mostly just the IT people know what I'm talking about, all those discussions now are secondary to the ability to take advantage of what the cloud can do every day to aggregate that data and allow you to take that data to do the right thing to empower your constituents and your employees. So Microsoft is in 140 countries, and we interact with roughly 140 governments, and we learn things from them. And we've taken very seriously as a corporate citizen what the United Nations Sustainability Goals are, which are, of course, the goals that we all have when we talk about government: ending poverty, ending hunger, taking care of our environment, expanding economic opportunity and economic development, and so forth. We take this very seriously, and what we do is we learn and we listen from all of the people that we meet around the world and across the United States, and try to bring that understanding into the company as part of our corporate culture to problem solve when we interact with our customers and clients, to be able to take those learnings and take advantage of it. So what digital transformation is taking that understanding and addressing these 4 pillars of activity. How do you engage your citizens? How do you take data and information, of which government has more than any array of multinationals, to be able to take that data and empower your employees, the civil servants who come in every day to work with the goodwill to be able to make things better, not only to deliver services, but to actually create new outcomes for the people that they're servicing, changing the way that those operations occur, how those business processes are run, and with what impact. A couple of years ago, there was a group of university professors who did the first, and to the best of my knowledge, the only study. It was published in Science Management Journal of state government and the influence and impact of technology on state government. And what they were able to find after reviewing some 44 states' IT budgets and the politics of how government was run, with a small p on the politics, they were able to determine that for every dollar invested in technology in a centralized way with an enterprise approach, the outcome was $3.49 savings in operations, not in IT, but in the actual operations and efficiency of government. And finally, the pillar is that when you're able to pull that citizens' engagement, empowering the employees with the necessary data that they need to be able to make good decisions, what you're able to do is you're able to transform services. And what does it mean to transform services? I participated with a state in something which was probably one of the saddest days in my life, which was to discover that over several years, 104 kids had died in Child Protective Services. And when we analyzed the situation, the singular reason why those kids died was because of the lack of the flexibility of the data in the case management systems to flow between intake, investigations, placement, and monitoring. So kids died because data, basic information, was siloed and didn't efficiently run dynamically into a presentation layer, into a tablet, into a laptop, into a report that allowed for decisions to be able to take care of those kids. So transforming services, for example, is how do we tackle the opioid epidemic, which we're working on very seriously at Microsoft with many state and county and city governments right now. The data exists. We have systems that have every doctor that prescribes. We know who they are, and therefore be able to identify who overprescribes. We know everybody who fills a prescription, and we have the access to that data. The people most likely to die next from an opioid overdose wind up in hospitals, and when they survive, those are the most likely people who are going to die next. We have information from law enforcement that knows the criminal element aspect of this. But the problem is, as I've described it, these systems are under health agencies' controls. They're under under human service agencies' control. They're under law enforcement control. They're under provider medical control on the healthcare industry. How do we bring together the security and the confidentiality to be able to bring all of that information together, to be able to deliver a 360-degree view? Right now, what we're doing is monies are going out to stop the opioid epidemic. We're doing a great job right now as governments in counting the people who are dying by zip code. Okay, that's certainly a start, but how do we actually take that information and the information that I've just described and begin actually changing it so we stop people from dying? We have the data to be able to do that. We have the ability to transform things this way. So the idea of engaging with our citizens and with our patients is really simply getting a 360-degree view. Do you have, where you work, a single record of your constituent? Many constituents participate and interact with government at multiple different program levels. We have to stop thinking programs. We have to start thinking people, right? We have to start thinking person-centric. We have to personalize, just the way the Ohio folks and the innovation officer for Colorado identified this whole concept of person-centric. That's what's going on in the commercial world. Why shouldn't government be doing that? We have to empower employees by taking data and making it available to them. So it's a really simple concept here. Think about this question: how many of you on the phone that are listening still sit around waiting for IT to give you a report? Think about that for a second. And how many reports on an annual basis do you ask your IT department for? If you're still asking for a report to be able to understand your business or analyze anything, call us pronto, quickly, because you're in need of digital transformation. The data should be available to anyone and everyone, certainly with the security, confidentiality, role-based controls that are necessary to be able to make those decisions. But the data is there and should be available for people to make good decisions. Microsoft is a security company. We are the #1 targeted entity in the world for hacking. What we do is we can collect billions of signals from all of the folks that are using our products. 430 million people use Outlook. The majority of you, that's what you use for your email. We take all of that information, we analyze it, and we share it with our customers. That's how we ensure that people are safe. The optimization of operations, that is about efficiency. And you know, whatever the political orientation now with a capital P you folks may have had, the one thing that certainly everyone agreed on in the last recent presidential election and as a constant discussion is that government is challenged, and people's perception is, despite all of the great work that we all do, that government just isn't matching up to things. The United Nations did a survey a few months ago about how governments are implementing technology and taking advantage of it, and ranked every nation in the world in terms of their success in making progress. I'll tell you that when you look up that study by the United Nations, you'll find that the United States isn't in the top 10 countries. So finally, what we're really talking about is transforming how we deliver those services from an outcomes-based perspective. My suggestion here, and the folks that I've seen doing the best, they stop counting what they're delivering, and what they're counting now is the outcomes. Are people getting jobs? Are people becoming self-sufficient? Has people's health improved? Is their well-being improved? Are they connected more to their communities? Do they have access to all of the resources that are there? Those are the kinds of things that we see as a way to transform services. So what I'm showing you here very briefly is how many different kinds of solutions we're providing directly for government, for health, specifically for public safety and education, and what we call City Next, which is the way that we wrap what I've been discussing as a way of helping cities at the base, if you will, of the political structure in our country to be able to solve problems. The listing is the kinds of solutions that we already have been helping different governments implement, very similar to what our folks in Ohio presented. And we're available here to help you problem solve and take advantage of that. So thank you for the opportunity to give you a little bit of an insight. Really looking forward to some questions from you folks on the phone, and I'm going to turn it over back to Jake.
Herb, thank you so much. A lot of really good and moving examples that you referenced there. So thank you for doing that. We do have one quick question here, a couple of quick questions actually, but one question here from the audience. Herb, specifically for you, can you restate and explain a little bit more about the study that you referenced that reviewed the return on technology investment? And that's from Melinda Kelly, one of our audience participants.
Sure, no, absolutely. So I believe it's the June issue of Management Science Journal. 3 professors from the University of Michigan, University of Illinois, and Temple. What they did is they collected data from some 44 states' governments, the budgets of those governments over 5 years, and then what they did is they did a significant amount of correcting for all of the political impact, labor, expenditures, budgets, so on and so forth, and compared it to the amount of money that was invested into information technology in those states. Now, in the commercial arena, what we call return on investment, total cost of ownership, those are black and white analyses because they're connected to the profit margin, the net profit margin that a company makes. It's much more difficult to do this for government. They did it, and it's a really, really compelling thing. And let me tell you, having been a government executive, I was the chief of IT's policy and planning for the state of Illinois. I was a CIO for agencies. I was an enterprise architect for health and human services in the past and have worked with a lot of state governments. I have never been, as an IT person, walking into a meeting with political decision makers or legislatures who until recently didn't think that IT was a cost as opposed to a positive to bring value. So that's if you send me a quick email, I can send you actually the link or a copy of the study. These professors have done a great service to government in the study that they've done. Jake.
Thanks for the great answer, Herb. I appreciate that. That was outstanding. I have one other question, unless there are any other panelists on the call who have a comment on what Herb was just talking about. Okay, so we have a question here from Les in Georgia, and Les asks the folks in Ohio, how did you encourage positive reception and cooperation from the county offices throughout your project?
Well, this is Matt Curran. I think it started really as a collaborative effort, and the folks in the counties that were in the initial pilot, if you will, were actively engaged, and so as I called out, they did some manual processes, and I think they informed themselves around person-centeredness and were advocates for the same. And the electronic tool, ImagineIS, that we developed really supported that. As we've moved forward toward broader adoption and really engaging all the counties across the state of Ohio, we continue to have those collaborative discussions and continue with our continuous circle of support team. And Michelle Burk's really been a really strong advocate and really organizer and driver of this continuous circle of support. But that team has engaged, our counties across the state to really continue to push the message, if you will, around person-centeredness. The department has, adopted key principles around person-centeredness, and so you've got to look at this as a business transformation. The ImagineIS is really just a facilitator for this business transformation. And so as people, learn of person-centeredness, individuals or people that are going to be served by DODD and the county boards, looking to be part of that person-centered process, individuals, families, guardians, and even providers, showing them the way, so to speak, and then the tool really just kind of follows behind and facilitates. Michelle, is there anything you'd want to add there?
I think for anyone heading down this path of person-centered planning, it is critical that you don't underestimate the culture change that has to occur in the counties. And so, we are providing all the support that we possibly can as counties are embracing the person-centered planning.
Great stuff there. And then we have, we're about to wrap up here, but we have one question for Brandon. Brandon, how do you encourage your communities to get involved in the digital service development process? You mentioned in your presentation how you worked with Go Code Colorado to make that happen. Can you elaborate a little more?
Yeah, I think there's a couple of different ways that we engage them. First and foremost was simply to identify them and organize them. I mean, we knew who the IT leaders that weren't IT at the agencies were, but we'd never really gone out and organized them into small groups or at least across agencies, and we've certainly done that. That has been one of the greatest things we've been able to do in order to route pilot programs to get that user focus feedback directly to our developers on the IT side that are working programs or applications. I think a lot of it too has been getting creative about working in the private sector as well as with universities and students, and ensuring that we're bringing in interns or co-ops with fresh looks at services that we're delivering, and really challenging them as well as their educators to kind of approach problems and be able to pitch in almost by service by another means. When we've done design sprints and hackathons, a lot of participants are there to learn systems that we're using, but what we found out is a lot of them really, this is an opportunity for them to provide input in their community and make a difference, even if they don't work directly for government. And we found that consistent with private sector and with the student population. So we've really built a pretty robust internship and co-op program to capitalize on that, and then direct relationships with the universities. I think kind of the last part is engaging with the developers and being able to provide them user experience guidance. I think there's not a developer out there that doesn't want to create something that is user-friendly and a little bit more fun to use. But a lot of that there's nothing in the process. I'll give you a good example. So if you are in the state of Colorado and you want a database, right now you contact IT, you probably contact your IT director who is in charge of that agency. The IT director then refers you to an IT program manager. The IT program manager is kind of the business process lead for an agency, and so they get the high-level requirements. Then they hand off the project to a business analyst. The business analyst is a business process specialist, and they're the ones that engage the solution engineers, which works great from our side. But if you're coming at it from the customer base at an agency, all you asked for was a database, and you've now talked to 4 people. It's probably a half hour each. You're 2 hours in, and you still don't actually have a platform answer. So it's really educating our business analysts, our developers, our solution engineers, and being able to offer up user experience questions early in the process so that we can get into that room and into that discussion earlier in the process, so we can show what platforms are being used, where we've established credibility or competence in similar requests, and kind of changing that internal system to make sure that we're addressing that first and foremost. Asking simple questions like, your end users, are they going to be using it at work, at home, on mobile devices? Are the people who are inputting the information, are they primarily desk-bound? Are they field operators? I mean, these questions now have a much greater influence on what downstream platforms you're choosing to deliver a service than maybe some of the limited, legacy system stuff that we could offer before. So it's both engaging and education.
That's a great point to end on, and really good points there, Brandon, so thank you for doing that. And so Herb, Michelle, Matt, Brandon, afraid that's it. Thank you so much today for sharing some of the essential lessons that you and your teams have learned. Appreciate all your help today.
Thanks, Jake. Thanks, all.
Thank you.
I want to thank our audience once again for tuning in today to StateScoop's webinar series. I'd also like to acknowledge and thank Microsoft for sponsoring today's program. Just a reminder, our program today will be available on demand approximately 1 day after the webcast and remain available for up to 90 days. You can access it and download a PDF copy of the slides from the resource list on the console using the same audience link that was emailed to you earlier. And again, please invite your colleagues to tune in. It's free, and all they need to do is fill out a brief registration card to view the entire program and also get the slides with all this amazing content. Look for more of our coverage on digital service innovation and all other state and local government coverage at statescoop.com. And on behalf of all of us here at StateScoop, this is Jake Williams. Thanks again for being with us.